Welcome to the first episode of the Roundtable of Rehab. So with co-hosts Michael and Rohan.
Howdy, what's going on?
And today we're going to be introducing ourselves and telling you a little bit about our background, who we are, and why we do what we do.
Yeah, let's get into it.
So just basically going to talk about our origin story. Sounds pretty badass to me.
Yeah.
And so where we come from.
Villain arc.
Yeah, absolutely. Well, now it's kind of like a villain arc now. It's not.
Yeah.
But I'll leave it over to you, so you could tell us. So Rohan's going to tell us a little bit about his background and origin, what he does and what his profession is, and then we're just going to roll on with it.
Yeah. All right. So,
Go for it, man.
well, first things first. I'm a clinical practitioner, specializing in osteopathy as well. So, the way that I kind of look at patients is a bit more broad compared to your other healthcare practitioners. But I've always enjoyed helping people. Always enjoyed training, strength and conditioning. I do combat sports, so I'm a national level wrestler. I've competed at nationals a fair few times. I was currently training for the 2026 Commonwealth Games, but they've just removed wrestling from the Commonwealth Games.
Bullshit, really?
Nah, they did. They replaced it with lawn bowls and extreme BMX. Yeah, I'm not even shitting you.
How's that make you feel? Horrible.
Horrible, mate.
Lawn bowls took over wrestling. That's fucked. All right, no, keep going.
Yeah, so also very, very fond powerlifter. I love powerlifting. Competed for a fair few years. I'm actually going back on the platform very, very soon. Date to be announced, but keep an eye on that one. Done osteopathy since 2021, but I started my education in 2017 at RMIT after deferring my 2016 application. I wanted a bit of a year off just to get some money under my belt, get some experience in the workforce before going back to uni and going back to education. So found that had a natural knack for helping people, and I wanted to pursue that route and ultimately take the next step and do medicine and be an MD, sports physician.
Awesome, man.
Yeah. What about yourself, Michael?
So quite similar to you actually.
True.
So I'm also an osteo and strength and conditioning coach as well. Got my level 1 in ASCA. Graduated osteo mid 2021. So just over a year ago. I participate in power building, so it's not really bodybuilding or powerlifting. It's kind of a little bit of both.
A bit of both. That's a pretty common thing nowadays, isn't it?
It is pretty common, I'd say.
Yeah.
It's like, you start off with like a strength-based movement. So you might do like a compound movement, like a squat, for example. You go pretty heavy as heavy as possible for a few reps, and then you just get stuck into your secondary movements, which might be like unilateral work.
Train like a bodybuilder for your accessories.
Yeah, pretty much.
Yeah, very nice.
I'm also a blue belt in Brazilian Jiu-Jitsu, so absolutely love that. And I've been doing martial arts since I was 17 years old. So I started off with Muay Thai and went into freestyle wrestling and MMA shortly after, and then discovered the beautiful world of Jiu-Jitsu in around 2017, 2018, and have been doing it ever since, apart from COVID.
Yeah, I still trained during COVID.
You still trained during COVID?
Yeah, our gym was open.
Do you want a medal? Do you want a medal? Like,
I'll have a first medal, thank you.
Yeah, I mean, to replace the Commonwealth Games, like.
Yeah,
medals.
I know.
Oh, too soon? Is it too soon?
Nah, you're good, mate. You're good. Don't worry. You just still won't. Still won't throw down me though.
No, that's
you
very
refuse
true.
to throw me down, so.
I mean, I just run away. It's pretty effective.
That's what jiu-jitsu guys do. You sit in your ass and back up.
All right. So, what made you want to become an osteo?
I would say the leading driver or the catalyst for wanting to become an osteo, or just a clinical practitioner in general, was seeing a lot of injuries during my time training. So I've done combat sports since I was about 8 years old. So I've done karate, kickboxing for as long as I can remember, ever since I could walk essentially. And along that journey, I saw a lot of injuries. Myself personally, I probably only would have had, small minor niggles or, little sprains and all this and that. But I would see some pretty horrific stuff a little bit later on, especially in the wrestling realm. So I started wrestling and jiu-jitsu, very similar time, 2018 actually.
Yeah, nice.
Which was really, really good. So my MMA gym foreman, I taught the kids karate for a while, and she said, hey, come down to the gym and throw down with the big guys, and I got my ass smacked around for a bit, but...
I'm sure you love that.
Nah, mate, but they don't like my double legs now, so...
Yeah.
And then I would see just a lot of injuries, and I think to myself, shit, well, how can I help it? Because I always had a natural knack for wanting to help people, and I think my biggest drive for that was, all right, well, let's go pursue a university degree in exactly that. And when I got injured myself with a little bit of a lower back injury, I went and saw an osteo. I went and saw a physio originally, but I didn't really like how they approached. It was very, back then, they were very just narrow-minded or very, short-scoped, I think, and just bend down and do this exercise kind of thing. after the examination. But when I saw an osteo, he was very thorough, very systematic with how he approached the assessment, and then the treatment plan was really, really good. I loved how he treated me with the manual therapy, and then also the specific exercise, because he was a powerlifter as well. So the specific exercises he gave me, and then he would progress those exercises. So it wasn't just do these 3x12 exercises and that's it. He would actually go, all right, next week we're going to progress. The week after that we're going to do this, and kind of laid it out for me in a way that I actually loved. And I wanted to carry that sort of passion and drive for helping those people, and I think that was the biggest catalyst for me in my pursuit for osteopathy. And I'll graduate in 2021 in RMIT. Now we're going to chase the big MD, the big medical degree, aren't we?
Absolutely.
Yeah, so
Absolutely.
Mikey, what about you?
So similar to you again.
Very
So
good.
I was like quite sporty growing up as a kid. So I played soccer for 10 years, did gymnastics for a little bit, and
Yeah,
some
you did.
yeah, and some athletics,
Oh, same.
and yeah,
Yeah, sprints
yeah,
was my
nice.
stuff.
Yeah, there you go. And then and then I went straight into martial arts
Yeah.
and to the gym and the weight room and everything like that.
Every growing boy's big
Yeah.
aspiration is just get as jacked and strong as possible. Isn't
Absolutely. And then I actually like did cheerleading for a little bit as well.
it? True.
I was
How
a
was
cheerleader. That was awesome.
Who with?
So it was a couple of teams. So it was RMIT, and then I did it with Atomic, which is a proper cheerleading club. And I was on a team called Blackout.
Yeah, nice.
So it was pretty cool.
Pretty uncommon for a guy to do cheerleading, isn't it?
Yeah, a little bit. But it was good fun. Like, threw the girls around, like caught them up in the air and
Yeah.
stuff like that. Did
Requires
lots
a bit
of
of overhead
flips.
strength, doesn't it?
Overhead strength.
Exactly
But that's
right.
kind of how I landed into the injuries that I still I was like dealing with for quite a long time. So I basically like had microfractures in my shoulders.
Shit.
And
That's gnarly.
even before that though, I dislocated my shoulder.
Yep.
So I was at bounce. I was doing some weird double back flip twist thing, and nailed it, by the way. But I just fell forward into the pit, and my arm came up, and it went into abduction, external rotation. The typical,
Dislocation
the typical
position.
anterior dislocation
Yep.
position. And I was referred to a physio so that's where obviously it peaked. My interest in physical therapy was originally a physio. Dr. Michael Chan at Top to Toe Health down in Templestowe. So he was amazing.
You still there?
He's still there.
Very good.
He runs the clinic. But yeah, helped me out just with rehabilitation, help goal setting, building rapport, and just took me through all the exercises and just built up my capacity with my shoulder. And now it feels fantastic. I can
Yeah.
still do everything that I love doing, shoulder pressing and whatnot.
Yeah, I saw that today, doing some overheads.
Yes,
Very good.
absolutely. So power banded overheads and
Jiu-Jitsu
everything
is
like
very
that.
taxing on those shoulders, isn't it?
Oh yeah, I mean, if you don't keep them in and stuff, people
Them
just
get
want to
moored,
yank
mate.
them, just want to
Arm
crank
bars
them.
and Kimuras.
But yeah, so that was, and I was just really taken aback by how professional they were, and I love the process, and I love building myself back up, and I developed this really thorough understanding of how injuries are rehabilitated and the process of the body's healing itself and tissue healing times, and going from just improving and getting back to normal range of motion all the way through to working on deceleration, concentric stuff, all that kind of stuff. So it really fascinated me, and I just knew, and I love helping people. I've always wanted to help people in some way, one form or another. So whether that be a doctor, whether that's a physio, or in the gym as a PT or strength and conditioning coach, whatever, I've always wanted to help people, and then osteo just seemed to be the right fit, man. So
Definitely.
yeah,
I feel like there's a lot more osteos who do powerlifting and strength and conditioning now that are coming out of the woodworks. I find from university.
absolutely.
It's a little bit of a movement now, I think. A little bit of
Yeah.
a revolution in the healthcare system.
Oh,
which
for
is
sure.
really, really good. So
Yeah.
now, origin story, villain arc.
The villain arc. Why we want to progress even further.
Yes. So
Now, the MD.
the MD,
The challenge.
the infamous MD.
Why we want to become physicians and osteopathic physicians. I'm not sure we're allowed to call ourselves that. I think that's an American thing.
It's
But
definitely American.
anyway, we want to become physicians, and I'll let Rohan explain why he wants to become a physician.
Yeah, well, very simple, really. You just want to help people, right? And,
true.
The natural calling, I think, for both of us is to help people. And how can we take that step a little bit further and pursue the ultimate goal? A very difficult goal, very long and arduous journey that a lot of people would give up just at the sheer sight of looking at how hard it's going to be. But my not many people know, but my dad got pretty sick in third year uni to the point where I actually probably had to think about quitting uni and work full time. I was working probably about 30 hours, 32 hours a week while studying uni. That's probably why I didn't do too much study with the boys.
Mm.
You boys know who they are.
Yeah, yeah. You guys can confirm that he did no study at all, right?
Yeah. So
Bullshit.
I remember going home after uni. It was Tuesday night. Finished uni, finished training. I come home and my dad had made me dinner. A good lad, right? And I just noticed that he didn't have any food in front of me. And I said to him, "Hey, you're not hungry, Dad?" He's like, "Oh, nah, not really." So I started chowing in and being a bit oblivious and naive to the situation. But he kind of just paused and said, "Son, I got cancer." And I think, fuck. I kept eating, but I was like, fuck.
Yeah, that's horrible.
So I had to figure out in that moment there and then, all right, well, do I quit uni to take up full-time work to kind of pay for rent? And, at this time, not the richest family, but there are a few other things that kind of play a part in me having to work full-time. And we'll discuss that another time, all right? But
Yeah.
in that moment, I felt pretty helpless. So it was stage 2 colon cancer. And I was thinking, oh, fuck, this could be it. Could say goodbye to my dad, or I don't know how treatment plan's gonna go, and he's asking me, what he should do because he's above 50, and what the government does, they give you these test kits to check for bowel cancer, right? And bowel cancer runs in my family, and I was thinking, well, I'll never forget how helpless I felt in that period of time. Being an osteo, I was third year osteo. What the fuck can I do? And I was like, well, nah, I've got to pursue medicine. This is it. I got to help people. I got to take that next step and catch those early symptoms and catch those signs in clinic in those patients coming in. And it's not just, common things occur commonly, but not all the time. All right. So he didn't have any symptoms, which is the interesting part. He didn't have all the typical symptoms you would have with colon cancer, but I just remember him telling me he had it, and I was like, fuck, well, something's got to change. And I think that was the biggest catalyst to me at that moment in the direction of my life. Is like, all right, I'm going to take the ultimate sacrifice and take the ultimate selfish part and do medicine to help people. So you got to be selfish to do medicine to help people.
Yeah, absolutely, do.
The dichotomy in that is crazy, right?
Oh, yeah, for sure. I mean, you got to make those sacrifices in your own personal life in order to achieve your goals.
Yeah, and I've always had a fascination with medicine anyway. I knew when I grew up I wanted to be in the medical field, whether it was paramedic, doctor, surgeon, anything. I was fascinated by it. So, and then that particular moment solidified where I was going to go. So, yeah.
Beautiful, man.
What about you, Michael? What was your origin story? What kind of made you want to delve into medicine and go on that warpath?
So, back in 2012, quite specific, I was doing my year 12 year, and I was just at home one day, and I had just finished studying, and then I was doing something out the back, like with Dad, we were doing some gardening or whatever, afterwards, and then we walked in the front door, and then Mum wasn't looking like too good, and we were just asking what's up, what was going wrong, and she just looked like she was like kind of in and out of consciousness like a little bit, and she has type 2 diabetes, so
insulin dependent or non-insulin dependent?
Yeah, insulin dependent. Yeah,
right.
So, but she wasn't managing it
okay.
as well as she could have been at that present time, and we just noticed that she had a couple of skin color changes, so especially in her eyes as well. So they were yellow, which is jaundice.
Liver.
So that's when you get a discoloration of your eye color. It can be in like the palm of your hands as well, and in your skin, and it's usually an indication of liver disease,
Yeah.
or like, and in her case, non-alcoholic fatty liver disease.
Yep.
And we were really concerned, and obviously nothing like that had previously happened in our family. So Dad and I rushed her to hospital, and the doctors. I remember the doctor, like the specialist, the endocrinologist. He was so like accommodating and lovely, and made my mum feel really, really comfortable. And I really loved like how he operated. I loved how the nurses treated her, and I loved how there was like an attending doctor there as well, or a registrar, who was looking after my mum when he wasn't there, and they were all really lovely, and they made her feel really like really safe and secure, and they took care of her, and they prescribed medication, and got her in a really good management plan, helped her with her diet as well, which
Explained it all,
just explained everything. And
I think so.
I just remember there was that circumstance. There was a couple others, but that was the one that just made me think, holy shit, I could really do this.
Yeah.
I love helping people, and I really,
Inspiration.
yeah, it was an inspiration. I really love this setting, and I would love to to be able to make an impact on other people's families as this man did as well. But then also, and like what solidified this journey and what made me really, I had more of like a burning desire and ambition to get there quicker was my mother actually had a heart attack in 2019.
Shit.
Um, which my dad did not tell me about until a day after because they wanted me to be like,
You know, I
they,
actually had the
yeah,
same. I had the same incident. My mum had a heart attack too. She had an NSTEMI,
yeah,
so
yeah, there you go.
non-ST elevated myocardial infarct to be specific. But yeah, I never forget. She didn't tell me. She's like, "Oh, I'm just going to hospital." Oh, I was in hospital. I was like, "What the fuck?"
Yeah,
Thanks for telling me.
but yeah, that's the thing. So like, they didn't tell me because they wanted to obviously protect me. They didn't
Yeah,
want me to worry
yeah.
whatnot. But
Mother's nurturing.
yeah, but same thing. Like, I went to the hospital. I was like, "What's up?" And the doctors were still, again, really lovely, really accommodating, and still gave and sat us all down and said, "You need to make some changes," which mum is still been doing to this day and is a
She
lot
good?
healthier. Yeah, she's
She's
a lot
good.
better now,
Yeah,
which is
my dad's good too.
fantastic. Um, and yeah, that's just basically sparked why I wanted to do it, as well as every now and again, you like as an osteo, you see scans and there might be something like an underlying pathology. You have no idea what it is, but it doesn't look good. You can't disclose to the patient what it would be, and
You gotta get those.
I almost feel like helpless
Yeah, yeah, yeah.
sometimes. Like, I really want to help that person and I can't. And so all these things have just led me to go,
What
look,
can we do more?
what can we do more? And I just want to be able to like help a lot more people.
Absolutely.
That's it.
I think the important aspect to take away from that. I mean, I know not everyone has the best experiences in doctors, or you hear tragic stories about doctors, not delivering the best care or being a very, not listening and all that, and not empathetic. But I think it's not. Someone might not remember what you did to them or what you said to them, but they will remember how you made them feel. And I think
Absolutely, yes.
with in your mother's case and your family's case, and even my case, my physio,
Mm.
just the way they made you feel and take everything into consideration, and just de-escalate what's happening and make you feel really, really good is so important nowadays. I think is a little bit forgotten, and it's only kind of just being touched on now in the education system. Is there's those bedside mannerisms and the more focus on the clinical approach to your patients, and
Yeah.
you know
The
instead of being
biomedical approach.
the biopsychosocial approach, which is what osteopathy really entails and takes into
Mm.
consideration. But I think it's really important that it's not just how smart you are, but how can you make a patient feel good?
Yes.
How can you make light of a bad situation?
Yeah, and that's what I think that we can really
Bring to the
offer
table.
as well.
Yeah.
And better late than never. I know it's but I always kind of think, oh, what if I just did a little bit better back in high
Well,
school,
how old are
or
you?
I'm 28 now.
28. I'm 25, right?
Yeah, so
I know.
it's not like it's completely fine. Like, it's not like we've run out of time or anything
Nah,
like that.
I
But
know doctors who are doing the first year rotations and they're 50 years old.
yeah, but so that's another like what inspired me to keep going. Like,
It's a degree and it's a career for life.
yeah, so that's what inspired me. Like, there's like 50-year-olds that I know that used to be mechanics or whatever that are now like full like fledged physicians, and
Yep.
they're making a massive change. And there's it really doesn't matter about like how old you are. It's like, if you really want something, you
You'll
can
go
go
do
and
it.
get
Yeah,
it.
absolutely.
But yeah,
Unwavering desire to get it and unhinged by failure, I think, is the biggest one as well.
yeah,
Like
absolutely,
the
yeah,
drive to do it. People kind of come out of school not knowing what they want to do. That was kind of my, in year 11 and year 12, I was like, oh, I want to be a lawyer. I wouldn't want to be the MD. I had all these things in the air because I want to do it all. But then a few things solidified those moments. But kind of reiterating, doesn't matter how old you are, you can achieve those dreams. Like I said, there are 50-year-olds doing their first rotations in the hospitals.
mm,
And I think it's really important to think that you don't have to go out of high school with that massive 99.97 ATAR, go straight into university, and then go straight into medicine. You have no bedside mannerisms. You have
mm,
no clinical experience. You have no ability to communicate with patients because all you've been doing is reading a textbook.
mm.
And I think coming out of osteo, having a bit of clinical experience, and going back into uni is probably one of the best decisions of my life. And
Yeah,
I wouldn't have changed that.
for sure. I mean, like, in hindsight, like, it just makes me like have a little bit of a chip on my shoulder now that are working
Bit
really
of an
hard.
underdog, yeah.
But yeah, but it just makes me think, oh yeah, like, fuck, I really wish that I, yeah, don't worry about that I makes me really wish that I had worked a little bit harder in high school. But you are right that we do have life experience. We do have, and that's not just with osteo. That's with like lots of different like little bouts of adversity that we've conquered along the way. Whether that's
Absolutely.
friendships and learning lots of things from my friends, my family, my profession, my just relationships
You
even.
get a chance to see things at first sight, and you get the
Yeah.
chance to see things clinically, which is really, really important because sometimes common things don't occur commonly. Like with my dad's symptoms, right? It's completely normal.
Yeah, exactly right. But like things have just basically taught us along the way, and I think that we have a lot to offer, and I think that I reckon we could change the game. I reckon we might have have a good chance to actually change the game a
That's
little
the
bit.
whole idea with this podcast is essentially, or the reason for this podcast is to give insight into another perspective on how to get to medicine, how we can achieve a better sense of patient-centered care, taking a bit more of a biopsychosocial approach to care, and kind of not changing the healthcare system because
Just giving our opinion and
yeah,
philosophy on like what we think is the best approach to particular cases, as well as whether that might be the healthcare system, like you said, or whether it might be particular injuries or
distribution of resources.
distribution of resources, or it could be like how a clinic should be run, where the osteo should be in private practice, whatever it might be. But the reason for this podcast is we're going to be talking about anatomy, physiology, and things that we find cool.
Yep.
Just our philosophy, how we run things, or how we do things.
Our journey into medicine.
Our
So
journey
we're
into
taking
medicine,
we're
yeah.
taking hopefully next year or the year after at the latest.
Yes, yeah. So we'll keep you guys updated on our progress.
These podcasts are going for a long time, so
Yeah.
don't worry.
So this will go through med school. This will go. And
100%.
it's not a matter of if.
It's a matter of when.
It's a matter of when. We're also going to be doing lots of the injury case studies as well.
Case
I
studies.
think you guys might find that pretty interesting.
How we rehab things a bit differently sometimes because not every practitioner rehabs things the same.
Yeah, exactly. And we're like bouncing ideas off each other potentially that you guys might find interesting in terms of your own training or rehab, or maybe even if you're in your own practice, if you are a practitioner or a physio or
an up-and-coming student.
chiro listening.
Yeah, if you're an
or
up-and-coming
a student,
a student coming up the ranks and wanting to do a little bit more or see a little bit more, we kind of can provide that as well, which I think would be really, really good. A few injuries that I've seen in the gym, wrestling, jiu-jitsu, bit more about powerlifting as well, what it's like in a comp prep,
Yeah.
what it's like prepping, what it's like doing a combat sport with powerlifting. That's a very big one I get asked all the time. Or how do you do your wrestling at such a high level and do powerlifting at the same time? How do you manage both? How do you manage fatigue? How do you manage injuries? How do you program it? That's the biggest one I get. And I think delving into that and giving you guys the opportunity to listen to that might give you a bit of an upper hand in your competitive edge. So, yeah.
Yeah, absolutely. Teach them about load management, or
Yeah.
how we load manage rather. And we're also going to have some pretty interesting guests on.
Oh, yeah.
Which we're super excited about. We've got some big names coming on, some big names in the physical therapy world as well as just in the medical world as well.
Bodybuilding,
powerlifting, absolutely everything. We're just gonna have guests for every modality. Like you're not gonna expect it, all right? Like that's just we'll leave it at that.
It's gonna be a kind of surprise at the end of the day.
It'll be a surprise. But what we are going to do, and hopefully you guys are still listening up until this point, but we are going to put in little question boxes on our stories for when we do have guests on, or just when we're about to release or do another episode. And we want you guys to ask us questions. Be specific. Be as thorough as you want, or just dive into a particular topic, whatever you want us to answer.
If you guys got an injury, if you guys are coming in with an injury and you've been a victim of poor practice or
whatever it might be.
Whatever's going on, we can help you as well and use that as a bit of a case history in the podcast. I mean, I got a lot of people coming in, and I'll go to the gym and I can't even get to my deadlift set up before I get bombarded by people.
Yeah, exactly. We could just basically do a Q&A at the end for any questions that you might have. So we'll chuck that up pretty much every week. And then what we'll also do is that we'll identify the week before we film we have the particular guest on, and then we'll put another question box up, but then you guys can ask questions that would be answered by them. So we'll read out the questions to the guest, and then the guest will answer.
Everything will be very organized,
Hopefully.
Nah, they will, trust me.
I mean, we're pretty. Hopefully, we're organised. We've been pretty organised recently, so that's pretty good.
It's good, mate. We'll keep that ball rolling.
Surprising, but it's been really good, and we're super excited to basically, just talk to you guys and release all this information, share this knowledge,
This content, this glorious content.
this glorious content, and hopefully we can get a pretty cool outro song on. We're gonna get Vegeta's theme.
Yeah, it's been the plan for a fair few months now, hasn't it?
Yeah, and now it's finally coming together. But on that note, thank you so much for listening to the first episode of the Roundtable of Rehab podcast, and stay tuned for the next episode of Dragon Ball Z.
Dragon Ball Z.
Of the Roundtable of Rehab podcast. Thank you guys again. We'll see you soon.